Hello and welcome. I'm Elisa Hernandez, a librarian at Stanford Health Library. Thank you for joining us for our talk, Medicare 101. It's my pleasure to introduce our speaker, Maha Justi. Maha is a volunteer HICAP Medicare counselor and is certified by the California Department of Aging. Maha has been assisting Medicare beneficiaries for the past 15 years with all their Medicare questions. She is a retired Silicon Valley engineer who enjoys helping seniors and their families navigate complex Medicare issues. Throughout the talk, please enter any questions in the Q&A box at the bottom of your screen. And throughout the talk, Maha will answer as many of those as possible. Over to you, Maha.
Thank you very much for the introduction. And let me share my screen. Greeting everyone, and welcome to a Medicare 101 presentation. Our goal for tonight is to give you the very basics of Medicare. So by the end of the presentation, you have an idea of your basic choices. But let's start with the basics, who we are. Well, HICAP is part of a state program called SHIP, State Health Insurance Program. Our name is Health Insurance Counseling and Advocacy Program. It is a federally funded program, but is largely volunteer supported, and it's administered by the Department of Aging. We provide Medicare education, and we provide one-on-one counseling. There are HICAP offices in California in every county. My county is San Mateo County, but the information I'll be presenting tonight is pretty much the same for all the counties. Our services are unbiased, they're free and confidential. We're not associated with any insurance companies. With that, let me go over the basic agenda for tonight. I will start with something called original Medicare, and the terminology is really important here. I'll go through the eligibility, enrollment, some basic coverage and cost. I'm going to go over how you would supplement this original Medicare, what are alternatives that you can have, and end up with some special topic. How do anybody becomes eligible for Medicare in the first place? Well, people have to be 65 or older, not to be confused with Social Security, which you may be eligible at 62. In Medicare, you have to be 65 or above. There are cases where you can get Medicare under 65 with certain disabilities. It's meant for U.S. citizens and residents. You can get Medicare on your own work history if you worked for 40 quarters and paid the what's called the FICA tax. It could also be on somebody else's account, like a spouse or an ex-spouse. Medicare covers only what's medically necessary. Okay, some of you might have seen this card. This is the basic Medicare card. We call it the red, white, and blue card. And basically, it covers two things. One is called Medicare Part A and Medicare Part B. Part A is largely for hospitals. Part B is for doctors. The program started in 1965, Lyndon Johnson. It's funded by payroll tax, general revenues, and premiums. To enroll in Medicare, you have to go to Social Security. That's the agency that actually manages the enrollment. However, once you're into the program, and the people that make all the rules for the program are another agency called CMS. This is the Center for Medicare and Medicaid Services. Both these are federal agencies. Medicare is fundamentally a fee-for-service type of insurance. Again, as I mentioned, only medically necessary items are covered under Medicare. So Part A, I would like to think of it as the insurance that covers institutions like hospital, like hospice, like facilities like skilled nursing care facilities, as opposed to Part B, which you think of Part B, you think of doctors, you think of outpatient, you think of testing, clinics, durable medical equipment, and so on. So how does somebody enroll into Medicare? Well, as I mentioned earlier, you have to be 65. Now, if you're 65 and you happen to be already collecting Social Security, then Medicare, the Social Security Administration already knows about you, and you don't have to do anything. They will auto-enroll you. So you will get your card in the mail. It's important, if that should happen and you don't want to enroll in Medicare, even if you're 65 because you're still working, then you need to call them to opt out. But if you want to enroll and you're collecting Social Security, it's automatic. Now, if it's not automatic because you are not collecting Social Security, let's say you're still working, or you decide you want to collect Social Security when you're 70, but at 65, you do want to have Medicare, then you have to actively enroll yourself. There are 3 ways where you can do that. You can go online into the socialsecurity.gov and then just click on Medicare, and then we'll walk you through the enrollment process. You could call them, or you can go to any Social Security office in person and enroll yourself. When can you enroll for Medicare? Now, as I mentioned, you have to be 65. But what happens is you have something called initial enrollment period. The initial enrollment period starts 3 months before your 65th birthday month, and it continues for 3 months after. So in total, you have 7 months to enroll. For most people that intend to be covered when they're 65, they can enroll anytime here, and it will be effective when they're 65. Now, if you wait until you're 65, then it will be effective the next month that you actually enroll. What happens if you don't enroll? Well, if you don't enroll in Part B, you have a 10% penalty on the premium for each year that you delay enrollment. I didn't talk about prescription drug, which is Part D. And again, there's a penalty if you do not enroll. And the penalty here is 1% of the premium, national premium, for every month that you delay enrollment. However, if you happen to be working, actively employed, and covered under an employer group health insurance plan, you may delay enrollment in Medicare without any penalties. So if you're 65 and you're still working and you decide you don't want a Medicare because you like your company's insurance, there's absolutely no problem. You don't have to enroll and there will be no penalties. Anytime we talk about any kind of insurance, we talk about the premium you have to pay every month. We talk about the deductible, and we talked about the copay. So let's start for Medicare, original Medicare. Again, original Medicare is Part A and Part B. The premium changes every year. For 2024, if you worked 40 quarters, which is 10 years, your Part A premium is 0. So, however, with Part B, there is a standard premium that most people have to pay. This premium will change with your income, but for most, I'll talk about that later, but for most people, for 2024, their monthly premium will be $174.70. Then there's a deductible. Now, deductible is the amount of money that you pay before your the insurance start taking over. Now, for Part A, which is hospital, there is a deductible of $1,632 per benefit period, not per year. So what does that really mean, benefit period? Benefit period, you like to think of it as 60 days. So you go to a hospital, the first thing they ask you, okay, you haven't met your deductible, we want $1,632. You go home, nothing happens, you come back day 61, your benefit period expired. You have to pay that amount again. So obviously, over the year, that could really add up. Now, for doctors, the deductible for 2024 is a flat $240 per year. So once you pay your $240 per year, then Medicare start paying your bills. So which brings us to the copay. Well, the copay is, as far as the Part A is concerned, it's zero for the first 60 days in the hospital. Hopefully nobody stays in the hospital for 60 days, but if in that case, it would be zero. If you stay longer than 60 days, then there would be a copay. As far as doctors are concerned, the way it works is that Medicare pays 80% and you pay 20% of an assigned bill. What does that mean, an assigned bill? An assigned bill is a contract between Medicare and your physician that basically Medicare says a doctor visit, how about if it's $100 for that specific code, for example. So in that case, Medicare will pay the $80 and you will be responsible for the $20. So when you look at that, again, that could add up. If you go to the doctor often and you go to the hospital often, that could add up financially. And we call these gaps. These are gaps in the original Medicare. For most people, they would look at that and say, well, I think this would mean that we're somewhat underinsured. Which brings us to the next topic, which if you only have original Medicare, how could I add to it or supplement it so I have, so I'm financially secure as far as extra payment that I might be liable for. So how do we supplement that? So here's the original Medicare. The first way people supplement that was something called Medigaps. So this word gap. So Medigap is a supplement that only supplement A and B, doesn't do anything else. So these are programs that are sold by private companies. They are regulated by the Medicare agency, but nevertheless, they are offered by private company. As a beneficiary, you are guaranteed to be enrolled in this program if you choose to, within 6 months from your Part B effective date. So once you start Part B, there is a clock ticking that you need to sign up for Medigap. And this guarantee basically said that you can go to any company that offers Medigap plan, and they have to take you. They cannot subject you to any medical exam, and they cannot charge you any amount other than anybody else in your age group. So this is a pretty important guarantee that we told people to really consider wisely once they start looking at Medicare so they don't miss that deadline. So this is, I apologize, kind of like an eye chart. So when people talk about supplementing Medicare with a Medigap policy, so the question is, what gaps do you want to close? So on one hand, you have all these list of items that you might want to close. For example, Part A deductible is the hospital deductible. Do I want an insurance that covers that? Then I would look at the available plans and decide to buy which is more appropriate. For me, the kind of gold standard used to be F, but F is no longer available for anybody who is became eligible after 2020. The next best is Plan G, as in girl. Basically, it covers just about everything except the Part B deductible, that's $240. So when you look at this, then you have to make a decision. Which plan do I want? Which gaps do I want to close? Again, you are guaranteed enrollment within the first 6 months from Part B. Medigap is secondary to Medicare, so it only pays with Medicare when Medicare pays because it supplements Medicare. So basically, you never really have to talk to your Medigap provider because the bill goes from Medicare straight into your supplement because the supplement is not going to pay for it if Medicare is not paying for it. The benefits, the basic benefits that I just show are the same for all providers. So whether you go buy it from Aetna or Blue Cross or AARP, they have to provide you, if you say I'm going to buy plan G, they have to offer you the same basic plans for G. They can offer you more if they want to, but the basic benefit has to be the same for all of them. Not all companies offer all plans. So let's say you take United Healthcare ARP, they might offer plan N and plan G and plan F. They're not required to offer everything. Once you are on Medigap, you have the right in California to be able to switch between companies. So let's say you start with company United Healthcare, and you decide the next year that the premium went too far up, you could shop around, and every year, on your birthday and 60 days after, you could change your plan to basically the best available price. And it's called the birthday rule. One thing to note that once you start a Medigap, you have this guarantee. However, you are guaranteed to be able to go down in benefit, but not go up in benefit. So for example, if you say I'm going to start with plan A, which is kind of the lowest number of gaps because I'm healthy and it's cheap, and later in life I want to go to G, you cannot do that. You can go down, but you cannot go up. So it's important to understand where is your starting point. How much does it cost? Well, it's a supplement to original Medicare. So you still have to pay your premium for original Medicare. If you have other than Plan F, you still have to pay your $240 deductible. But then after that, the Medigap itself, it could be anywhere between $100 to $300. It depends on your age and which plan you pick. It's immediately active once you pay your deductible. And the copay could be zero if you have, let's say, take a plan G. So then you're from your doctor to Medicare, Medicare sends it to the supplement, you don't see anything. Okay, well, for most people, that's still not enough. What's missing is the prescription drugs. Again, prescription drugs is something that is used to supplement this original Medicare. It's a private companies. Again, it's regulated by the Center for Medicare and Medicare, but it is offered by private companies. In order to buy it, you have to have A and or B. Again, there's a cost associated with Part D. The providers decide what is the premium going to be. For 2024, for example, I've seen that this year in San Mateo County, there are plans that is 40 cents. The cheapest plan, the most expensive plan is $180. The deductible, the maximum deductible is set by Medicare. Could say, well, I want my deductible to be zero. It's totally up to them. They could say it's $200, but the maximum they can ever have is $545. As far as the copay will very much depend on the medication you take. There are tiers, whether you're taking a generic medication or a brand medication, and each company has their own tier schedule that they would basically tell you upfront how much it would cost. This is where it gets a little bit complicated for most people because the prescription drug plans has different phases. Let's say you go out and buy a plan. The plans itself all of them have 4 phases. Starts with a deductible phase, and who pays what? There are 4 possible people that can pay: you, your plan, the pharmaceutical company, or Medicare themselves. So for example, in the deductible phase, basically you pay 100%. You pay 100% until you reach your deductible. And again, this deductible is different for different companies. Once you reach that number, it could be zero because some companies say we don't have a deductible. But once you get there, then you go into the next phase. The next phase is called initial coverage. Now, initial coverage, basically the Part D provider, prescription drug company provider says, we'll tell you how much you pay, a certain percentage, we'll pay the rest. So depending on your medication, if it's generic, they might say you pay $0 or $1, and we pay the rest of the retail price, or 50%. Again, this is completely up to them. Now, this phase ends once the out-of-pocket is $5,000 and $5,030. Now, very important to note that this amount is not what you pay, it's the amount that you pay and your plan. So if you're paying, let's say if you have a medication that costs $1,000 a month, and your copay is 10%, you'll pay $100. Your plan will pay the other $900. But what gets counted toward this maximum number would be $1,000. Once you reach that number, then you come into what's called the coverage gap. We used to call it in the past the donut hole. So when you get here, you have to pay 25% of the retail price. Your plan pays 5%. The manufacturer pays 70%. And again, you stay in this donut hole until the amount of what is being paid comes up to $8,000. Once you are there, then you are in the last phase, which is called catastrophic coverage. Now, luckily, in 2024, once you're in catastrophic coverage, the copay is $0. In 2023, it was 5%, and still 5% of a large number could be quite a large number. In this case, your plan will pay the other 15%, and Medicare themselves will pay 85%. So for some people that just take generic medications, they never really make it down this stack here. For some people that have very expensive medication, they could be at the catastrophic right from the beginning, because they run through all the phases very quickly. But the end result here, that's $8,000, is not really what you pay yourself out of pocket. It's a sum of the various payment, and on the average, what you end up paying yourself is something like maybe between $3,000 and $4,000. Now, it's important to note that a lot of people are aware that the plans, the prescription drug plans, and their pricing are pharmacy dependent. And they have three categories. They have something called preferred pharmacies, they have in-network pharmacies, and out-of-network pharmacies. So when we run through the analysis of which is the best plan for somebody, there is a website called Medicare.gov, where you can enter your medication and basically tells you all the available plans in your zip code. And if you say the pharmacies, we have people that say, I'd like to only go to CVS. Now, CVS might be in network, but guaranteed, even if it's a network, it might not be the best price. So unless your printout says preferred, we could say, well, you could save $1,000 if you go across the street to Costco or Walgreens. Most people are not aware that this option is available and may end up overpaying. Each company have their own formulary. They don't have to cover every medication. And that's why it's very important to go through Medicare.gov with your medication to see if it's covered or not. Because all these phases and the the donut holes and all these numbers that I talked about in the previous slide only really counted if not covered by your plan, then you're basically on your own. Nothing gets counted. You end up paying everything yourself. So it's really important to know if your medication is covered or not. Each plan has their own restrictions, quantity limited, pre-authorization, step therapy. So again, you need to pay attention of what that all means when you're evaluating a prescription drug plan. Plans are zip code specific. We get people sometimes, they say, my cousin in Sonoma has this plan that she really likes, but it's really quite irrelevant for your particular case where you live on your medication. Another thing that also a trap that people tend to fall into, that they think there is something magical about getting their prescription drug plan from the same company that they're getting their supplement. The company might be giving you a 1% discount, but that would not be enough reason to just put in an autopilot and go for the same company. So we recommend that people evaluate these things independently, and if the same company happen to offer the best deal for you, then by all means go with the same company. But there's no advantage really to just ignore it and just go with the same company. Okay, so in this section we covered original Medicare. This is a very specific terminology, original Medicare, which is A and B, but we now understand that it has a lot of gaps and we know how to supplement them. We have something called Medigap that we can buy to supplement, and we are guaranteed to buy it within 6 months from our Part B date. And we can also buy a prescription drug plans. And these two things are sold by private companies. So with all these four things, then you can say that you have really good coverage. So this is a good point to stop and take some questions before we move on.
Okay, I see a few questions in the chat that I'll read out now. Are the Plan D criteria the same as Medigap? Can you only go down in coverage, not up?
No, prescription drugs are completely independent. You could choose everything, anything, every year.
Can you delay Part D or start it later on, or is it part of the same 6-month grace, or is it part of the 6-month grace period?
So again, if you are 65 and you are enrolled in an employer, actively employed, and either you or your spouse are covered under a prescription drug plan, then you may delay Part D enrollment without a penalty. If you don't have that and you just don't feel like taking Part D because you don't take medication, you don't want to take Part D, and you decide a year later to take it, there would be a 1% penalty for each month that you delay starting 65.
Can I have Aetna for Medigap and Blue Shield for Part D?
Absolutely.
There's a question about this recording, so just so everybody knows, it will be posted to our YouTube channel later on, and if you would like a copy of the recording, you can reach out to the health library. For Part D and supplemental, how can we sign up? Is it through the Social Security office?
No, so the original Medicare is run by the Social Security where you sign up. However, for Medigap and Part D, these are private companies, so you actually have to call these private companies to sign up. So first of all, you have to know who is offering what, and that's what we do at HICAP. We aggregate all this information. So somebody would come to us and say, what's available in my county, in my zip code? Well, we say, for Medigap, there's these companies and these are the plans they offer. And we can also give you initial pricing. There are websites on the California Department of Insurance, which give you the initial pricing. So you don't have to call every one of them to find out how much it costs. So that's information that during our counseling, we can tell you how to research. The same thing for Part D, for prescription drugs. There's an excellent website, medicare.gov. You go in there and you enter all your medication, your zip code, and it will tell you exactly all the plans in your account and your zip code. And there's a button that says enroll, or if they give you the phone number where you can come and enroll.
If you miss the chance to
Any
decline,
more questions?
yes.
Mhm.
If you miss the chance to decline Medicare and you're charged a penalty, how would you enroll and get the penalty to stop?
Okay, so it's actually if you are okay, so if you forgot to sign up, the only way to stop the penalty is to sign up. Now, if you're enrolled automatically, then you just have to call Medicare to opt out. Tell them, they say, why do you want to opt out? You say, I'm working and I'm still employed, right? Even though I'm collecting Social Security, I'm still employed. That's the only time they will enroll you automatically. It's not a penalty. It's basically auto enrollment. So if you're auto enrolled and you want to opt out, you physically have to call Social Security and tell them to opt out.
Okay. And are the Medigap and Part D premiums per month?
Yes, the premiums are per month.
Do all doctors take Medicare Part B? If not, is there a provider list?
Okay, that's a very good one. So all providers take Part B. So B is for doctor, B as in boy is for doctors, and not all providers took Medicare. So you specifically have to ask them. There's a very, the original Medicare doesn't have the concept of an HMO. So the network, so to speak, is basically everybody that has a contract with Medicare, which is most of the doctors. There's some specialists that choose to not participate in Medicare. And if you find one of those specialists, you basically try to call and they would say, sorry, we don't take Medicare.
Are there, is durable medical equipment part of B or D?
It's part of B as in boy. So D as in David, drugs is only prescription drugs.
And there's a question about dental coverage and if you have any information on that or anything that you would recommend.
Okay, so original Medicare does not cover any dental, vision, or hearing unless it's something medical. For example, associated with, like, if you had an accident, you broke your jaw and they need to do a surgery. So in that case, it would be covered under Medicare. Anything else would not be covered under Medicare. So for that, some of the Medigap plans offer some benefits. They try to attract your business, so they might offer a dental plan for, let's say, $35 a month. You could also go out yourself and get dental insurance. So these are extra things that private companies offer to try to get your business. But what we tell people is first decide on the Medigap policy on its own with the basic benefits. Then if they're throwing in an option and a rider like dental or vision, look at it, but also compare it by going on your own and just going to Delta Dental, for example, and taking insurance.
Someone who is age 77 and still working with their employer has a question on whether or not they could still be grandfathered into Plan F when they retire.
So the for Plan F, if you were eligible before, so even if you have not signed up, but you were eligible before 2020, then you're eligible for F. But what we tell people, the only difference between F and G is this $240 per year. So if the premium for F is really high, I mean, you can take the 240 divided by 12, and if the premium is too high, then honestly, it would not be worth it.
Is it possible to use both Medicare and your employer insurance together?
There are cases where for small companies under 20 people, and you're eligible for Medicare, you can have that. There are also cases where you can have Medicare primary and your employer as a secondary. But if you're actively employed, you have the right to get the same plan as anybody who is under 65.
Is there a birthday rule for Part D?
No, there is no birthday rule for Part D, but there is an annual enrollment that I'm going to talk about later. So every year you have a choice of changing your prescription drug plan that we highly recommend that you take advantage of.
If you miss the deadline and get the oh, sorry, go ahead, Maha.
I'm sorry, go ahead.
If you get the missed deadline penalty, do you have that penalty forever, or is it just for the first year?
You have it for the rest of your life.
I'm retired, but my wife still works. Right now, I am on her works insurance. Can I stay that way, or am I required to sign up for Medicare? Can I do both?
You are not required to sign up for Medicare as long as you covered under an employer active plan. So if your spouse is still working, you're absolutely can stay on it until she retires.
Okay, that's all.
Okay. Just a word of in this particular situation where somebody is working and eventually, let's say they're 75 and now they're stopping to work and want to go get Medicare. When they go to Social Security, the first thing they can ask them, where have you been? You're 75 and you should have signed up when you're 65. You say, well, I was working and covered, or my wife was working and we're covered under an active employer plan. They say, okay, take this piece of paper and go to your employer. And the employer certifies that you were covered from the age 65 until now. So that's the way that Social Security would waive that penalty. And when you get to that point, we can give you that form so you can plan it ahead of time. Okay? So let me continue then to the next part. So now we talked about the original Medicare and how to supplement it. So let's talk about alternatives. So this is what we talked about, and this is what's called fee for service. You go to a doctor, they have a fee plan, they deal with Medicare and your supplement and so on. Now, at one point, a new breed of plan came called Medicare Advantage. Now, unfortunately, it's called Part C, but it's really not part of anything. It's a completely all-in-one plan. And basically what happened, private companies came to Medicare, the original Medicare, and says, look, we can do a better job. We can save you money. So how about if you allow us to offer the services that you would otherwise have to offer yourself here and pay for, and we will offer it and throw in these extra things all in one. And these plans are called Medicare Advantage. They are not an advantage or disadvantage. This is a purely marketing name. Now, those plans tend to be HMO or PPO. That means there's a concept of network. These are the doctors you can go to. And these are preferred network. So it's a little bit wider, but you probably end up paying more copay. Now, as opposed to this side, there is no concept of network. Anybody that has a Medicare contract will take you. So an example of here would be like a Kaiser. That's clearly a Medicare Advantage plan. So you cannot have both. You can have either this group here or here. And then here, basically what happened, the original Medicare and the federal agency don't process your claim, don't have anything to do with appeal. They have nothing to do with you. You basically are dealing with this company alone. Obviously, they have rules they have to follow. So, but nevertheless, these are all-in-one private companies. Very important to notice, if you go here and you decide to stay longer than the trial period. A trial period is 12 months. If you stay longer than 12 months and you want to go back, you say, I hate it, I don't like this idea, I want to go back. You can go back. You can go back to A and B immediately, but you no longer have a Medigap guarantee. So this is a very, very important to tell people up front, because people don't realize that they might be giving up their right to a Medigap. There are some cases where you get this guarantee back, but we try to emphasize upfront that if you go to one of these plans and you love it, great, stay with it. There is no problem. The other thing that I would want to warn people about is the same private company could be offering all these three. For example, United Healthcare has, ARP has a Medigap plan. They have another division that does nothing but offer Part D plans. They have another division that offer nothing but Medicare Advantage plan. So when somebody says, I have United Healthcare as my Medicare coverage, that really doesn't tell me anything, which one. And this is very important when you start getting flooded with literature. You look at it and you say, what are they trying to sell me? I know it's United Healthcare, but what are they trying to sell me? Are they trying to sell me a Medigap plan, a Part D plan, or a Medicare Advantage plan? Well, what is the cost of these Medicare Advantage plan? Again, you still have to pay for Part B. Some people also have to pay for Part A if they don't have the 40 quarters, but you still have to pay it. And on top of that, the Medicare Advantage plan could decide what additional premium they should charge you. There are many plans that are zero. They said, we don't know, we don't want anything else, that's fine. And we plan $120. There is no deductible. The plan is immediately available to you to use, but the copay is extensive. So what do I mean by that? This is kind of an eye chart that we try to, HICAP offices, look at all the plans that are available in our county, and there might be something like 23 plans. We get all these plans, get all the information, and then go down the line and say, okay, what is it? It's an HMO, it's a PPO. How much is the premium? Is it $48? Is it $97? It's zero. What's the maximum out of pocket? And what are the rules? So the rules basically would say, with this plan, which is an Alignment Sutter Advantage, it says you can only go to these hospitals. So if you say no, it's a showstopper. If I cannot go to Stanford, then this plan is not good for you. And so on. So you have to very carefully go through these hospital selection and also the medical practices, which doctors you can go to. Unfortunately, in HICAP, it would be impossible for us to try to figure out which doctor takes which plan. So we always tell people, call your doctor and talk to their billing office and ask them, are you taking Alignment Sutter Advantage, or are you taking Anthem Blue Cross? We have to be very specific, because if you say, are you taking ARP? Well, they don't know what you're talking about, which ARP that is. So this is something that you need to very be aware of from upfront. So pros and cons, it really becomes more of a lifestyle choice and also a budget choice. So you can go the route of Medicare plus supplements and so on. And in this case, you can go to any doctor or any hospital that takes original Medicare anywhere in the US. So you decide you want to go to the Mayo Clinic, you get on a plane and you go to the Mayo Clinic, provided they will give you an appointment. Now, in the Medicare Advantage, you have a network, so you cannot go outside the network. However, if you have an emergency, if you happen to be in New York and you have an accident, then you can go to any hospital and any doctor, and you will be charged the in-network price, but that's only good for emergencies. In most cases here, you don't need a referral. You can go to any specialist. You wanted to see a heart specialist, a cardiologist, you can go to a cardiologist. If they're accepting new patient, In this case, you have to have a referral from your primary. There are people are quite happy on Medicare Advantage. The network is where they live. They don't travel much, and it fits their lifestyle. Some people that have a year here, have a year in Florida, have a year somewhere else. You cannot really say one is cheaper than the other, because if you are extremely healthy, you don't have any copays, this definitely would be cheaper. But if you are not healthy and you need services, you pay every month, and basically you don't have to worry about it because you paid it already. On this side, there's also out-of-pocket maximum. So out-of-pocket pays it. Again, it's a lifestyle choice. And the issue really is not how your health is today, but how is it going to be for the next 20, 30 years? So that's kind of what you have to anticipate. Well, other ways to supplement Medicare is through your employer. So there's a number of employers that offer retirement plan. So in this case, they tell you, sign up for A and B, and we are going to be your supplement. You don't need to go get a Medigap, and you don't need to go get a Part D. We will be your supplement. And they will tell you their formula, they'll tell you the rules, but they're basically they're your supplement. There are other employers that say, no, we're going to offer you an HMO, and you stay within our HMO, and this is what we offer you. Depending on the company, these plans used to be extremely generous, but over time, see that things are getting not so generous, and it doesn't mean that you have to take it. Compare it to the normal Medicare and Medigap, and make the appropriate choices. So many choices. You can have original Medicare, A and B only. You don't have to have a supplement. But if you don't take Part D, you might have a penalty. You will have a penalty, and you'll be financially exposed to all these gaps. It's something that we do not recommend, that you just have A and B. You can have original Medicare plus a Medigap plus a Part D. You could leave this stack altogether and go with completely private company through Medicare Advantage. You have the supplement with your employer, either as an Advantage plan or as a supplement plan. Or there's some people that have a VA plan or a federal employer plan. They don't even have to take Medicare. They could be very happy with their veteran plan. In all these cases, be aware that you will likely use your guarantee for a Medigap. You can get this guarantee back. For example, if you take a Medicare Advantage plan and they decide we're not going to offer that plan anymore, they terminate, not you, they terminate, then you get this guarantee back. If your employer retirement plan decide one day we're no longer going to be offering a retirement plan, then you get this Medigap. But again, it's they, not you, that makes that choices. So this is something to be very aware of upfront. Okay, so that's ways to alternatives to original Medicare, and maybe it's a good time to take some questions.
Okay, there are a few questions in the queue. Can a retirement plan from a former employer require you to start their Medicare Plan Advantage when you turn 65, even if you're working somewhere else?
Normally, if you have an employer, I really need to look at the detail because it's more of an unusual case. So I would, if you are working, they cannot require you to take a Medicare at all. But if you're already retired and then working somewhere else, that becomes a little tricky. So I would say, call us at Medicare at HICAP, and we can look at all the specifics.
Are there any options for dental coverage for retired individuals on Medicare, or where can we find information regarding dental coverage?
Well, again, dental coverage is not under Medicare, so they're under private plan, could be under private plan, or you could go to a insurance broker, and they, I'm sure, can help you with dental insurance. And if you are employed or have a retirement plan, the best place is to call your benefit administrator. They should be able to provide you information.
How is Medicare Advantage different than private health insurance? Are premiums less?
Well, Medicare Advantage have to live by Medicare rules, so it's not up to them. They have to provide the services that Medicare offers, but within that framework, they can decide which doctors and which hospitals and all that. Now, private health insurance without Medicare at all really depends on what you buy.
Does Stanford Healthcare accept Medicare Advantage?
Does what?
Does Stanford accept Medicare Advantage?
As far as I know, no. They had a Medicare Advantage plan in the past, but that no longer exists. So the only plans that the Medicare plan that Stanford accepts is the original Medicare and a supplement. I should differentiate. Stanford Hospital might be different than Stanford Doctor. So there are some plans like I think ARP that you are able to go to Stanford Hospital, but not the doctors.
If I relocate to an area that does not have the HMO I signed up for, can I get re-qualified for the Medigap option?
Absolutely. So this is one of the cases where if you go outside of the service area, that your plan, if you have Kaiser, for example, and you move to a state where Kaiser doesn't exist or a county, then you get your Medigap guarantee again. But then the time limit is shorter. It's like 63 days. You have to sign up.
Can I go with the employee retirement plan and then later decide to go to the other Medigap plan?
No. I should say no in the sense that if you go with the retirement plan and it's not an active employer plan, so the 6 month you would not be within the 6 month, so therefore you are not guaranteed. I should qualify when I say you cannot have Medigap, it doesn't mean they won't take you. It means that you don't have the guarantee right. For example, Blue Cross has something running on right now. It's called underwriting holiday. So they say, we don't care if you have Medicare Advantage for the last 20 years. Well, it hasn't been around for 20 years, but we don't care if you have it or not. We will take you during that time, but you can only sign up for our Plan G, and it will cost you a bit, but we'll take you anyway without any underwriting. That's completely up to them. They have it this year, they might not have it next year. But your guarantee right is only from Part B and 6 months, unless the plan themselves, if your retirement company closes shop and say, we're not offering retirement plans anymore, then you get that guarantee back.
Okay, that's all for now.
Okay. Let me go through special topics. I talked about this initial enrollment, which when you first turn 65, and you have 3 months before and 3 months after. The other enrollment period that I'm not going to go through, but just be aware when you hear these terminology. So the one that I talked about a little bit is special enrollment. Special enrollment could be any time of the year where you have a special reason to enroll. Your insurance company terminated, or you stopped working. Basically, that's a special enrollment. Could be any time of the year. You go to Social Security and you can sign up for Medicare. There's also something very important called annual enrollment period. Annual enrollment period is for people already on Medicare, and they want to reevaluate their plan. This is only relevant for Part D, prescription drugs, and Medicare Advantage. This is and you decide whether you want to make any adjustments or not. There's something called coordination of benefits. When you have original Medicare and Medigap, we said Medicare is your primary insurance. This is the first payer. Medigap is your secondary. If you have Medicare Advantage, only Medicare Advantage pay. There is no secondary. They're the only people that pay. If you have a retirement plan, and Medicare is your primary, and your employer is a secondary. So first Medicare would pay, then the employer will pay. COBRA, this is something very that we run through. If you have COBRA, Medicare is a primary and COBRA is a secondary. And this could be really tricky. So if you were eligible for Medicare before COBRA, so let's say you're working and you're 65, so you are eligible for Medicare. Whether you signed up or not is irrelevant, but you were eligible for Medicare because you were 65 while you're still working. Then you got to COBRA, you get laid off and you got COBRA. And at that time, COBRA is your secondary. And this is a very nasty surprise for people that sign up for COBRA, which is quite expensive. And they get a denial of bill rejected because COBRA said, I'm just a secondary. I'm not supposed to pay first. Medicare is supposed to pay first. But you never signed up for Medicare. Although you were eligible, well, too bad. You're liable for that. So this is something very, very important to notice. Now, if it's the other way around, if you're eligible for Medicare, you became eligible for Medicare, COBRA will stop. You cannot have Medicare, COBRA after that. Okay, so annual enrollment. Annual enrollment is the time where you evaluate your what you have and see if you like it. This is October 15th to December 7th, which is right now, and for coverage that starts January 1st. And this has nothing to do with Medigap. This only has to do with Medicare Advantage or prescription drug plans. Because Medigap has, the changes for Medigap is your birthday. So it's a bit confusing, but basically this is a time where you can evaluate your drugs or Medicare Advantage. It's a time to confirm your coverage, confirm that your network, and they send you something, say here's a new premium, and here's the new doctors in the network. And you could love your doctor, but he didn't sign a contract with the Medicare Advantage plan, so you'll be out of luck once you January 1st and you find out that your doctor is no longer on that Medicare Advantage plan. So opportunity to correct any mistakes that you made and to avoid surprises once the year start. Okay, what can you do during open enrollment? You evaluate your Medicare Advantage. So let's say you had a plan with Blue Cross and you didn't like their network, you could go to ARP. So, you get a list from HICAP or you call around and you decide which plan you want. You could also, you say, I really hate this Medicare Advantage, and I want to go back to original Medicare. This is a time where you can do that. Or you had A and B and nothing else, and you say, oh, gee, it's too expensive for me because I have all these things because I don't have a Medigap and I'm not eligible for Medigap. Then maybe it's better for me to go to this in this direction. So this is also the time to be able to do that. It's also the time to be able to look at your drugs and say, are my drugs covered under this company, or should I change company, and what's the copay and what's the deductible? So this is the time to do that, and we highly, highly recommend that people do that. If you cannot do it yourself, we are here to help you do it. But what you cannot do during that time is do anything with Medigap. So you cannot add or change because Medigap had nothing to do with open enrollment for this time of the year. I mentioned in the past there is a website called Medicare.gov, Medgov, very specifically, not .com or .anything else, it's .gov. You go there and you either set up an account or you can just go as a guest and you say, find a plan. You give it your zip code. You could do a comparison with either 2023 and 2024. And it leads you through, you enter all your medications and it will tell you, okay, this pharmacy is a network with this medication, this is what it will cost you if you go to WellCare or if you go to Silver Script and so on. So you need to know that, and if you find that your plan is no longer fitting your needs, this is the time to enroll in the new plan that will be effective January 1st. Okay, so the takeaway from here is actually very quickly is that everybody pays a standard premium. Not everybody, but for A and B, there is something called standard premium for Part A and for Part B and Part D. There's something called IRMA, which is something that is based on your income. So the standard premium, when I say Part B is $174.70 for most people, provided your income is up to a certain level. Well, Social Security looks at your income, your modified adjusted gross income. They actually go into the IRS record from 2 years before and see what you said, what your income was, and they decide whether you have to pay more, a surcharge based on your income or not. So there are some life events. So it could be something like you were working 2 years ago and you get this letter from Social Security say, sorry to tell you, you're going to have to pay $70 more a month because your income is too high. Then you say, oh, wait a minute, 2 years ago, my income was high because I was working. Now I'm no longer working. My income into 2024 is nowhere near what it was 2 years ago. So please review that again. It's called an appeal. And once you do that, then they will reduce it to the standard rate again. Now they're not gonna do that on their own unless you actually go to them and ask for that, and they're not gonna give you money back if they already charge you money. Just to give you an idea on that income for 2024, if you're single, 103, then you pay the standard premium. There's no surcharge. But if you're single and your income went above $1 above 103, you're going to have to pay almost $70 more. So it's kind of nice to keep in mind, whether you're single or joined, that at the end of the year, do you need to take that $10 out of your IRA if you're really at the edge? That would kick you off the chart. Same thing for Part D. It also has a surcharge, not as high as the Part B, but nevertheless, it still exists. Okay, some updates. Some of you might be aware that in 2023, insulin was capped at $35. Vaccines are zero copay. And if you enroll in Medicare, it's effective the next month. 2024, the main change here is that 5% for Part D catastrophic is now zero. Now, the good news in 2025, Medicare out-of-pocket is going to be capped at $2,000. So you'll never pay more than $2,000 for your medication. Okay, so the takeaway is Medicare A and B by itself, we call original Medicare, and it has gaps. You could supplement these gaps by buying a private plan with a Medigap company and a Part D prescription drug plans. You have a guaranteed under certain fixed condition to have that Medigap, but that is not forever. You can elect to leave the original Medicare altogether and go to Medicare Advantage, but be aware that you might lose your Medigap guarantee. unless you have a specific case that gives you that guarantee back. And during open enrollment and during a birthday, review the plans, even if you love them, because a lot of these private companies are counting on the fact that you put things on autopilot and you think this is the way it is, but this is not the way it is. Unfortunately, these private plans are made for shopping around. And if you're not shopping around, most likely you're paying too much. What do we do at Medicare? At HICAP, I'm sorry, we offer one-on-one counseling. We can review your plans with you or for you and give you the results and have a counseling with you. We can tell you about the various financial assistance program that's not only for low income, because there's a lot of pharmaceutical programs that are for middle income people. We can help you enroll if you don't know how to enroll in any of these plans. We have special phone numbers to contact Medicare with people that actually answer the phone immediately, and so we can talk to them on your behalf. You don't need to be there to resolve an issue with Medicare. If you have an appeal with Medicare or the provider, we can help you through that process, aggregate the information so you don't have to run around looking for who is providing what plans in my county. In summary, we educate, inform, and advocate on your behalf, but we cannot pick a plan for you. Okay, so this is my presentation. This is our phone number. As I mentioned, I am in the HICAP San Mateo, but the information I presented is pretty much the same for every county. But if you want individual counseling, you would have to call your county. So this is our HICAP, the numbers for our county. Any final questions? I know we're running a bit late. I apologize, but if you have any questions, I can answer.
There are a few questions. If you are on Medi-Cal and turn 65, do you have to switch to Medicare?
Well, if you are on a Medi-Cal, there is something called a Medi-Medi. So you actually end up having both. So depending how you choose to receive your Medi-Cal, and that's a whole topic by itself, you could have Medicare and Medi-Cal. But be aware that if you go to a Medicare doctor, Medi-Cal becomes your supplement. And some doctors may not accept that as a supplement. So then you will be liable for that 20% yourself. Unless you ask the doctor specifically, are they willing to bill Medi-Cal? Now, Medi-Cal themselves have specific group plan, HMOs for people on Medicare. And it does include Stanford, for example. They have some actually very good programs. So if you need any more information or what we call Medi-Medi, I would suggest a counseling appointment with us.
Can an Advantage plan deny you because of pre-existing conditions?
No, they cannot. The only ones that can deny you is Medigap if you're outside of the guarantee period.
Is IRMAA annual?
It's monthly. The IRMA, it's something you pay every month.
And there are a couple of questions asking about any other workshops, maybe some offered by HICAP. Can you speak to that, Maha?
So we have in libraries, we like I'm doing a talk November 7th in a library, for example. So most of the libraries, if you look at the library, San Mateo library programs, they have a lot of these. We're out doing presentations. But again, you can call us anytime and we'll happy to do one-on-one counseling for your specific case.
Okay, and no more questions, but I'll read out one comment. This has been very helpful. Needless to say, it is very complicated. Look forward to getting the video. Thank you.
Great. Happy to hear that. I think one of the very important things that, if anything, you can get away from this presentation is really understanding this concept of original Medicare with a supplement versus Medicare Advantage, because honestly, a lot of people don't know what they have. So they just know they have Medicare of some sort, but they don't know if it's an Advantage plan or, and I tell people, if you have the red, white, and blue card, it doesn't tell you anything. But if you have a Medigap card, then you know which side of the equation you're in.
One last question. I've heard complaints and articles about Advantage plans denying coverage. Can you comment?
Well, I mean, they have the rules, right? So I cannot really generalize, because there's some plans that are very good, and they are private company, they are in the business to make money. So there are cases where your doctor might have to make a stronger case. Why is this medically necessary? And you certainly have the right to appeal their decisions.
Okay, that's all for now. Thank you, Maha, for sharing this great information. And thank you to our audience for joining us and for the great questions. If you'd like additional information or resources, please contact Stanford Health Library, and we hope you'll join us for our next lecture.